Hi, this is Dr. David Klein at the Stages of Life Medical Institute in Longwood, Florida. What I want to talk about right now is something that we're seeing a lot of here at Stages of Life. I'm sure other doctors' offices, when they actually see patients live and in person, as opposed to on the telephone or through telemedicine, are picking up on depression. You know, there are many ways a trained physician, can pick up on depression in somebody who doesn't necessarily complain about it. If you ask about sleep, how are you sleeping? Okay, fine. Stammered answer. Okay, sleep. Deprivation leads to depression, and depression leads to sleep disorder. It's a frickin' frack arrangement here. Each one leads to the other. But depression is its own damage. Okay, you're going to find yourself gaining weight. You're going to find yourself snapping at your family. You're going to become ineffective, inefficient, and probably impotent before it's all said and done. So what do you do about depression and fearfulness? Most important first step, something you can do, okay, is to correct your sleep habits. Don't go to sleep with a TV, okay? The bedroom is for sleeping. It's called sleep hygiene. Don't turn the TV on. Don't read in bed. When it's time to go to bed, you close your eyes, you hit the pillow. If you have a hard time getting to sleep, we'll get to that in just a second. Lights out. Okay, that's important. That means all lights are out. You black out the windows, curtains. You make sure that appliances don't have little blue lights on because they will, in fact, keep you up. Sleep deprivation right now is a big problem. You can make anybody depressed, anybody and everybody, by depriving them of sleep for as little as 3 or 4 days. After 2 or 3 weeks, they become clinically depressed. How do you like that? So I tell my patients I can make anybody depressed for a nickel, okay, and actually get change back. Why? Because I can take a thumbtack, tape it to your buttock, okay, and it will keep you from sleeping. You will become depressed, angry, inefficient, and develop fibromyalgia. Gee, okay, all treatable illnesses in my practice, put my kid through college. So the idea here is to do that which is necessary to ensure a better night's rest. So how do you do that? Well, I've tried this, I've tried that. I can't take melatonin, it gives me nightmares. I'll tell you what, if melatonin gives you nightmares, it means you need it, okay? It means you're not hitting REM sleep, and then when your body does, it bounces back with a vengeance. So you take something called GABA, not gabapentin, but gamma-aminobutyric acid, GABA, all capitals. The dosage there is about 1,500 milligrams per day, and you take it with your melatonin. What does it do? It knocks you out, allows melatonin to do its job, but it does it without you remembering the nightmares. You still have them, you just don't remember them, in which case it doesn't really matter now, does it? What else can you take to induce sleep? Help with the depression, help with the underlying issue. L-theanine, that's capital L-THEANINE. Dosage is 200 milligrams at bedtime. What does this do? It deepens your plane of sleep. It's what's called a soporific. It's the same thing that's in turkey that makes you feel sleepy at Thanksgiving. It's actually pretty decent stuff, very inexpensive. In fact, none of these are expensive. When taken in combination, the idea is to hit you onside the head, as they say locally, with a fist. It will knock you down and out. And after a period of time, usually 3 to 6 weeks, your body will readjust its time clock. If you are a shift worker, okay, this is helpful, but it's not going to help you until you're no longer a shift worker. They give people shift worker differentials because you all get sick, okay? This is going to make you unhappy. Nobody works nights and weekends, because they want to, okay? They want to be antisocial. You don't want to go out on the weekends? Okay, fine, we'll pay you more. So you make a trade-off here. So fear is dysfunctional imagination, okay? What does this mean? Being fearful doesn't get you anything. Fear is not what it's about. You can be concerned, and you can be more concerned, but being fearful allows your emotions to take control. So we are getting through this. You're going to be fine. We're going to get you sleeping again. We're going to get you eating better. And once you get out of your house, you'll even be pooping better. These are the sorts of things that are going to make you feel better, but only you can deal with fear and worry. But the depression we can deal with starting by getting you a good night's rest. This is Dr. David Klein at Stages of Life, sleeping tight.